Okay, so welcome to another video where I'm going to be talking about the post-deep structures of the neck, okay? Now, before anything, we have to enumerate what is the content of the deep structure, and by the way, the deep structure of the neck refers to roughly this area about here. I've cut out most of the nerves, as you can see. It refers to basically the back end of the neck. So let me just fix something really quickly and just highlight it. So when we talk about the deep structures, okay, we go beyond the anterior and posterior triangle. It's roughly about this amount of remaining area. So basically the thyroid, all of this removed posterior to the esophagus. This is what we are talking about. Now, the contents of the deep structure of the neck. I will talk about the first thing that we have to be concerned with are the brachial plexus in the deep structures of the neck. So here we have, all the superior, middle, and intermediate, superior, inferior trunks of the brachial plexus. Here's the middle. So the first structure in the deep structure of the neck is the brachial plexus. The second is the internal jugular vein. Here we have the internal jugular vein. See, I've cut out most of the veins, by the way, so I've cut out a lot of them. But this is the internal jugular vein and the subclavian vein right over here. This is the brachiocephalic. This is the subclavian. Usually you can see this. This is the brachiocephalic trunk. The subclavian vein here. So the internal jugular vein, okay, and the subclavian vein are part of the deep structure. So we mentioned two structures. The brachial plexus, the superior, middle, and inferior, and the internal jugular vein. The next thing are the muscles that form the posterior triangle, like your scalenus anterior, medius, and posterior, your scalenus muscle, and we will be talking about them in a second. So anterior, middle, and posterior, so the ones that make up the posterior triangle. And the last few ones, so we mentioned internal jugular vein, the scalenus muscle, and the brachial plexus. So we have two left, which are the hyoid bone, which I have removed here. Okay, I have removed the hyoid bone. I can't show it right now because I have to do everything again. So the hyoid bone right over here. So let me just use the pen. You would have the hyoid bone just about here. And the viscera of the neck, basically the connective tissues, like a little bit of the thyroid gland, so on and so forth, all of this, but that is not shown here. The next important thing we have to talk about are the prevertebral muscles. So we have two types of prevertebral muscles. We have the lateral and the anterior. So we're not going to be talking about the posterior. So we have lateral and the anterior over here. So these are obviously the anterior prevertebral muscles, and over here these are the lateral prevertebral muscles, which are clear. The first one that I have, it's not shown here, again, is the splenius capitis, okay? Not the semispinalis, the splenius capitis, which extends from here and it extends all the way down, the splenius capitis. So this is the first muscle I have to talk about. The next we have are the levator scapulae, okay? So the levator scapulae is this muscle here is the levator scapulae. So if I show it real quickly, here we have the levator scapulae attached to the scapula and attached to the vertebral column. So two muscles I've mentioned, the splenius capitis, which I just drew, and the levator scapulae, along with the scalenus posterior, middle, and anterior. So three types of muscles basically in the lateral region, not the posterior, the lateral region. It depends on your textbook, but here we are talking about the lateral region, so it's on the lateral side. Now, these three muscles that I talked about, the splenius capitis, levator scapulae, and these scalenus muscles are part of the posterior triangle. Now, we will move on to the anterior muscles. The anterior muscles we have are the longus colli. So here we have the longus colli, obviously. And you can memorize longus colli and by the way, so the longus colli and longus capitis, you can see this is the longus capitis and the longus colli. The way you can memorize this is they are very long, okay? Now, colli, okay, capitis, you can memorize capitis as C as captain because it's attached to the skull directly. So longus capitis is long and attached to the captain, which is the base of the skull. And the longus colli, you can memorize it as a coma, which is always a bit inferior to and is attached to the vertebral column. So longus colli and longus capitis, they're both long. And how do you memorize the longus? Longus are always usually on the same lines. They're not lateral, they're more medially located. So you have longus colli and longus capitis. And the next muscle we have are the rectus. Okay, now the rectus, we have anterior and posterior, and I'll be talking about them in detail, and not in detail, but I'll be talking about them in a second. But rectus, okay, rectus, you can memorize them by them being quite short. Okay, so rectus are really short. So rectus are really short. I can't really write it here, but really short. So they're rectus. Okay, sorry, there really are. So the rectus are really short. So by that, what I mean is, where is the rectus muscle located? So here we have the rectus anterior capitis, and here we have the rectus lateralis. So the rectus are attached to the base, but they are very short. They're not like the longus. So remember, we have the longus capitis, which is the captain attached to the bone, and the longus colli, which is long, attached to the vertebral column. The rectus are also, all of the rectus are attached to the occipital bone, basically not the occipital, but basically in general, the base of the skull. So we have the anterior rectus, but this one is rectus anterior capitis, and this one is rectus lateralis. Okay, so this one is lateral and this one is anterior. So this makes up the muscles of the anterior prevertebral muscles. Now, with this in mind, I will go over some of the other stuff. Now, when we move on, now I want to talk about the suboccipital triangle. Now, the suboccipital triangle is a very, very small triangle. It's just around here, this area specifically. But in order to see the suboccipital triangle with cadavers, we have to remove the trapezius. This is the descending part of the trapezius. Let's remove it. Hold on, let's remove it. It's not letting me remove it. Let's see why it does that. Hold on 1 second. Let's fix it. Sorry, I'm back. So we have to remove the trapezius, the descending part of the trapezius. We have to remove the semispinalis capitis. This is the semispinalis capitis. We have to remove the splenius capitis. And here we have the suboccipital triangle. Now, when we are concerned with the suboccipital triangle, we will be only focusing on just 4 main muscles. Now, remember, we will be talking about the limitations, okay, the limitations of the suboccipital plexus, and a little bit about the components. So let's actually talk about the components first to make things a bit easier. It's already very easy, but let's make it easier. So we will have, actually, we will have 4 structures. We will have arteries, number 1. We will have veins, okay. Let's make it in detail. We will have, let's make the arteries in detail too. We will also have nerves, okay? Okay. So actually 3 structures, not even 4, 3 structures. Arteries, veins, and nerves. So what are the structures then? So the arteries, this is actually, you know, the vertebral artery, but we have a suboccipital artery. So branches off to the suboccipital area. So this is the first structure, so the suboccipital artery, very easy. We also have a suboccipital venous plexus. So it has its own kind of venous plexus just around this area. I'm not sure this program shows it very well. It just shows the vertebral veins, because these are the vertebral veins, by the way. But there should be, yeah, these are the deep cervical veins. But it should have its own venous plexus. And finally, the nerves, we have 2 important nerves to talk about, okay? We have the suboccipital nerve and the dorsal ramus of C2. So the suboccipital nerve arises from the dorsal ramus of C1. So this is the first cervical nerve. This is the suboccipital nerve. This nerve comes from C1 of the first cervical nerve. Basically, it supplies all of the 4 muscles I'll be talking about in a second, and I'll remind you as well. We also have the dorsal ramus of C2. However, the dorsal ramus of C2 over here, so 1 second, so these are the great occipital nerve. The dorsal ramus of C2 isn't shown very well. If I can, the great occipital nerve is actually the dorsal ramus of C2, sorry. But yeah, the dorsal ramus of C2, okay, it also supplies part of the sensation. So the dorsal ramus of C1 over here supplies the muscles, the four muscles I'll be talking about, and the dorsal ramus of C2 is also present, the dorsal ramus of C2. So let's talk about the boundaries, or the four muscles I've been talking about. Let's just remove all of these structures to make it very easy, and my way of memorizing these structures is very, very easy. So the first structure, the first thing is medially. Okay, so here we have the rectus capitis. So look, let me get my drawings. So when we're talking medially, let's get this pink thing here. Medially, we are limited by the rectus capitis posterior major. So here, remember, this is the rectus. Okay, this is the capitis. Remember, all the muscles attached to this bone we call them the capitis. But here, because it is on this side, on the occipital, very close to the occipital, internal occipital crest, I'm not sure if it's the occipital crest, but assuming this is the internal occipital crest, attached to the internal occipital crest, we will call them the rectus again. Okay? Rectus capitis. And this one, medially, this muscle right here, the rectus capitis posterior major, will form the medial basically boundary of the suboccipital triangle. Laterally, okay, we have the obliquus capitis, not rectus, the obliquus capitis. Okay, it's obliquely placed. So I'm gonna try to show it very well. So here, how do you distinguish? So remember, this is the internal occipital the inferior knuckle lines, not the, sorry, here we have the superior knuckle lines, and here we have the inferior knuckle lines. If they're attached to the inferior knuckle lines, we will call them the rectus, okay? And we will add capitis, because remember, this is the captain, this is the skull. So we will add rectus and the captain, capitis. So rectus capitis. And this one is posterior major, okay? Now, we also have the oblique capitis, okay, oblique superior capitis, okay. This is called the oblique superior capitis. This is superior. So, and this forms the lateral boundary. Let me draw it. So remember, this is the medial boundary, and it's formed by this muscle. This is the medial side. And the lateral is made by the superior, obliquus capitis superior, okay. We have inferiorly, which is made by the obliquus capitis. Remember, this is still oblique. This is the obliquus capitis inferior. So the lateral side, obliquus capitis superior, and the inferiorly, obliquus capitis inferior. Now we also have the floor, and I'll be talking about the floor. The next thing we have is the floor, basically. I think we talked about the medial lateral, we talked about inferior. We actually have the roof and the floor, okay? The roof and the floor are quite easy. I think you can kind of figure it out very easily. So the roof, if we remove this, the roof is formed by the semispinalis capitis and longissimus capitis. So here we have the semispinalis capitis. I don't know if you can see it very well. And this is the multifidus. This is the semispinalis colli. So basically the semispinalis capitis and the longissimus muscle, longissimus capitis. And the floor is made up by the posterior arch of the atlas and the posterior atlanto. So here we have the atlas and the atlanto-occipital membrane. So if I can just turn on the connective tissues, we have the this is the ligamenta flava. We have the atlanto-occipital we have the posterior atlanto-occipital membrane. These form the floor. Okay. Now we talked about the suboccipital triangle. We will move on to the next topic in a second. Okay, let's continue onwards. So the next thing we have is the root of the neck. Okay. So when we talk about the root of the neck, we all know we all have like a neck, obviously. So the root of the neck is the part of the neck that joins, let's remove the connective tissue, that joins the thoracic cavity. So the neck, the junction of the neck and the thoracic cavity. Now where is this located? Let's actually remove the sternocleidomastoid and the omohyoid muscle. So let's actually add some arteries and some veins, and should we add some nerves? Okay, no, never mind. I'll just add the basics. So let's make it easy, because I'm trying to make it as easy as possible. Okay, now. So what is the limitation of the root of the neck? Okay, this, by the way, is the clavicle. Let's remove the clavicle to make things a bit easier. So the limitation, let's remove the this right pec major, and let's talk about what we actually mean. So if we look at this body, the limitation of the root of the neck, laterally is the first rib and the first intercostal cartilage. So this is the first rib, this is the lateral limitation. Anteriorly is the manubrium of the sternum, so the manubrium. And posteriorly we have the T1 vertebra. Okay, it's just a bit up actually. Yeah, it's just around here. It's not exactly there, but kind of there. So posteriorly T1, anteriorly manubrium, and laterally the first cervical, the first spine and the costal cartilage. Okay, so it's very, very easy. You can memorize it like this. So this is the limitation and the boundaries. Now let's talk about the contents. The contents are very easy. You have nerves, arteries, veins, and organs. The organs are very easy. You know, your esophagus, your structures. You know, you have your trachea, esophagus, and thoracic duct. I'll not even talk about them. Always easy. You have your arteries, veins, and nerves. So arteries, we have the brachiocephalic trunk. Here we have, this is the subclavian artery. So this brachiocephalic trunk, the subclavian artery, the common carotid and subclavian artery are on the left side. I forgot to mention. So here we have the common carotid and the subclavian artery. They're on the they're on the left side, and on the right side we have the brachiocephalic trunk. I don't know if you can see this, but yeah, here this is the subclavian. Here's the brachiocephalic trunk. So yeah, this is basic knowledge. This is like before. Yeah, this is very easy. So arteries are it's clear. With veins, we have the external jugular. Now this is the internal jugular, but here we have like the external jugular and the anterior jugular, which isn't visible here. Let's make it visible. Okay, here we have the anterior jugular, so external jugular and anterior jugular and the subclavian vein. Okay, we're not talking about internal jugular vein, according to this textbook at least. So we have anterior jugular. Remember, they meet up at this jugular venous arch, at the transverse arch. So external jugular, anterior jugular, and subclavian veins. Okay, these are the veins. Now the nerves are also very, very easy. It's almost like child's work. So obviously you have your phrenic nerve from the vagus. Now the phrenic nerve supplies the diaphragm. So this is the first nerve structure. Then we have the vagus nerve, we have the recurring laryngeal nerve. Here we have the vagus, and we also have the recurring laryngeal nerve. I don't know if you can see it here. I think this is the ansa cervicalis. This is the inferior root of ansa cervicalis, just about here. It's very deep, I think. Yeah, this is the superior cervical. It should just be around here. You know what, I'll just give up. I cannot find it right now. So we have the phrenic nerve, which is very important for breathing. The next is the vagus nerve, obviously, which I just showed. The third is the sympathetic trunks. Okay, so we have inferior, middle, and superior cervical ganglion. I don't know if I can show it here. This this is the cervicothoracic. Okay, vertebral ganglion, middle cervical ganglion. Yeah, here it is. So here we have the middle cervical ganglion. We should have the inferior and the superior cervical ganglion. So we have the sympathetic trunks. So the sympathetic trunks include the superior, middle, and inferior cervical ganglion. And finally, one of the most important, the brachial plexus, as we all know it. Okay? So remember, the nerve structures we have, the first one is the phrenic nerve, which supplies the diaphragm. Second is the vagus nerve, which is over here. And we have the recurrent laryngeal nerve, which is this is the thoracic cardio. Like I said, I'll just give up on it. We have the sympathetic trunks like the ganglion, superior, middle, and inferior cervical ganglion, and finally the brachial plexus, which is just about here. Now, we finished the contents, and I will not go over through the relations anterior, middle, and posterior, because I think it's very clear. And I will talk about the subclavian artery, okay? Now, when we talk about the subclavian artery, I want to actually put a heavy emphasis on it, so just give me a moment. 1 second, let's fix something. Now welcome back. Now I'll be talking about the subclavian and the vertebral arteries very briefly, It's very, very easy. So let's remove the scalenus anterior muscle, which is a very important landmark, the scalenus medius and the scalenus posterior. Let's remove a lot of these muscles, including the subclavius, your sternohyoid, or this is the sternothyroid. Okay, now. So when we're talking about the subclavian vein, we will divide it into 3 parts, okay? The first part, okay, will be of the subclavian artery. The first part will be the vertebral artery, okay? So the first part will be the vertebral artery. And I'm not talking about, the common carotid. I'm talking about the subclavian on the left side. So on the right side it might be a bit different because, you have the brachiocephalic trunk, but here's the left side. The first branch we will have is the vertebral artery, which supplies blood to the vertebral column, okay? I'll be talking about it in just a second, in just about 2 minutes. The next branch we have is the thyrocervical trunk, which is just here. Now, the thyrocervical trunk will give rise to the superficial cervical and the suprascapular artery. So here, this should be the transverse cervical, not superficial cervical. So the transverse cervical, or the superficial cervical, you can call it. And the suprascapular artery. So here's the suprascapular artery. It anastomoses with different arteries, but yeah, so I'm not going to be talking about this. So the vertebral artery is the first part is a vertebral artery, consists of the vertebral artery, the thyrocervical trunk, okay, along with the internal thoracic artery, just about here. So these are the first segments. So let me just make a line. So this is the first segment. Okay, we're going to ignore this artery in a second. I'm going to be talking about it. So this is the first segment. The second and third, we will be talking about it in just a second. So the second and third, beginning from this artery right here, is the coscocervical trunk. Now the coscocervical trunk is part of the second segment. Now the coscocervical trunk has 2 branches, which are the deep cervical artery and the subcostal and the superior intercostal artery. Okay, the superior intercostal artery, this is the deep cervical artery here, and the superior intercostal artery is just about here. Or it's called supreme intercostal artery, but I call it it's the supreme intercostal artery, not superior, sorry. The deep cervical artery and the intercostal artery. Now, the third branch is the descending scapular artery, which this is the internal thoracic. Basically, the descending scapular artery should just be about, I don't think I can find it. I think it should be here. This is the dorsal scapular artery. I don't think I can see it here, but basically we should have the deep scapular artery as the third part. Now let's talk about, just briefly, about the vertebral artery. I will actually divide it into 3 parts, okay? Now, the first part of the vertebral artery, you can memorize it as the cervical part. Okay, you can memorize it as 1 cervical, or CVSC. CVSC. What does it stand for? Cervical, vertebral, suboccipital, and cranial. So the last part of the vertebral artery is the cranial part. The third part is the suboccipital part. The second part is the vertebral, and the first part is cervical. So you can say cervical, vertebral, all the way here, suboccipital, and cranial. And that's just about it. That's the end of this video. Hope it all makes sense and hope it helps. Have fun.